Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this week's story episode, we are going back to the brain, and in particular, cranial nerves.
Yes, so this is another BOC IRL episode, which is, if you guys haven't been following our new series, which we're doing BOC topics in real life. So this is not just for people studying for the BOC, although we are going to give some BOC nuggets of knowledge. This is also for just listening to other people's stories and experiences with cranial nerves. Luckily, actually, we haven't gotten a ton of people who've had diminished cranial nerves.
Okay.
When I did the poll, only about 14% of the people of the ATs who answered our poll had ever seen a diminished cranial nerve.
Oh, interesting.
Which I don't know if it's good that I've seen it more than once. So I think I have a few stories that we're gonna put in here.
I mean, you work football. The chances are a lot higher than...
I've seen one in football and one not. So that's 50-50.
The one I saw was not. It was in basketball.
Okay. I don't think I know that story.
Yeah. Oh, it's a long time ago.
Okay.
Long time ago.
So I knew it was going to come up. So obviously in the beginning of this episode, I decided to put how you remember the cranial nerves. And pretty much almost every response we got was the inappropriate one. Literally, that's what people wrote. They didn't even write it out. They just wrote the inappropriate, or they'd put a little emoji.
Yeah. Well, I mean, that does help you remember it. That one really sticks out.
Yeah. What do you have a mnemonic?
Not a clean one.
And I feel like not only is there one dirty mnemonic, but like I feel like there's multiple.
Yes, there are.
Like one of them I heard the other day was like XXX rated.
Oh,
like,
man.
Yeah, it was like every other word. I don't even remember it, but I was like, oh. We were all discussing. We were like,
If this was a song on the radio, you wouldn't get much of the lyrics.
No, definitely not. So I grabbed two from our listeners who, this one actually I'd never heard before.
Okay.
So Lena H said, only one of the two athletes felt very good, victorious, and healthy.
Oh, man, that's cool.
And I was like, that's AT related.
Yeah.
I haven't heard that one. And then so I was like, where did you get that? And she was like, well, I did a Google search in undergrad, and that was the only one that stuck with me.
Yeah.
The only thing that I have trouble with all the mnemonics is like, oh.
Yep.
You get stuck on like, okay, which one is olfactory, optic, ocular motor?
Yep.
Because there's three, you know?
Mm-hmm.
And then some of them like 2 V's. So you have to figure out which vagus, what order.
Yeah.
I mean, not that you really need to know the order as much in real life.
Yeah.
I feel like when you're documenting.
I would say when you're documenting.
You could just be like, oh, let me look it up real quick.
Yeah. Yeah, as long as you have just that right one on the paper.
Right.
I know a cranial nerve's not working right. Let's see which one it is.
Right, exactly. I don't think the person who has a diminished cranial nerve is going to care if you know if it's number 9 or 10.
Yeah.
For our Harry Potter fans, there's one on. They traveled and found Voldemort guarding very ancient Horcruxes.
Oh, that's really good.
I know. These are ones I've never heard before.
Yeah.
I thought that was really good too. So I made one up.
Oh.
For AT Corner.
Okay.
Because obviously we need to have one.
Of course.
And it's about our new BOC IRL episode series. Are you ready for the cheese?
I am ready. I'm always ready for cheese.
Okay. Maybe I need help with the beginning part because I just used the same word 3 times. But ought to tell a friend, AT Corner, one word, films very good videos about homework.
There we go. That is very true. We do.
So there you go. There's our AT Corner officially stamped cranial nerve mnemonic.
That's right. It's out there now.
Exactly. So I also asked if people tested cranial nerves in the same order every time. And you would imagine, I feel like with evaluations, you kind of like get your routine.
Yeah.
Only 65% of ATs in our poll
interesting.
Actually test in the same order every time.
I feel like I do. And not even like on purpose. I just kind of do. Because I'm definitely not like in order of 1, 2, 3.
Right.
I just have the same order of what I normally do.
How do you do your order?
I feel like I always start with accessory.
Really?
I don't know why. I have them shrug first. I don't know why.
Oh, that's interesting.
I mean, I guess sometimes it kind of depends if I'm looking at VOMs. Because then I just pair in my cranial nerve with that. Because of the smooth pursuits.
Okay.
But, yeah, I feel like I tend to start with accessory. I don't know why.
I do that one last every single time.
Interesting.
I don't think I've ever seen you test cranial nerves.
Yeah, I'm not sure. Yeah, I don't think when you've been at a game or anything, I haven't really had a situation.
Or maybe
where
I
to.
have. If you're doing I've seen you do a concussion eval. So, so our first story is from Joe S. She said, many times I've seen AT students forget all of the cranial nerve tests, so I search for ideas to help remember them. There are many mnemonics out there, but sometimes they don't help students, so we go back to very basic memories of learning the parts of the face. As little children, we learn to identify eyes, ears, nose, and mouth. We always said it in the exact same order. I tell my students to think of all the tests they've learned that deal with those parts and then add in the face and balance to finish it off. They seem to learn the test faster that way. I also found cartoon pictures that work well to remind them what each test is.
Nice.
This made it a fun learning experience. I've taught 6th through 12th graders and also parents of young athletes with this system and always get good feedback on it. They only need to find positive tests to report to medical caregivers and not make a diagnosis. They also learn the best test and about cognitive testing and how to do it.
Nice.
Which, that brings up a really good point because that's why I don't remember any mnemonics, because I feel like I have to remember the order and it doesn't really help me, but the face, the drawing of the face, that helped me a ton.
Oh, that's awesome.
And I also, I do mine by body part, like the eyes, ears, nose, but I do, I literally scan from the top of the head down. So I start with the eyes. I always start with the eyes because if I don't do the eyes, I will forget. If I don't do pearl, I will forget. So I start with the eyes and then I start top forehead. I move to ears. I move to smell. I move to the mouth. So biting down, stick out your tongue, all that. And then I do shoulders.
Nice.
And bounce.
Nice.
And so does Brittany B. She said, I start from the top down. So sight, hearing, smell, taste, mouth movement, and then any accessory nerves. And I had no clue that we did it the same way.
That's cool.
Yeah.
That's awesome.
It's the only way I can remember it.
Yeah, I don't know. I just kind of picture the list in my head and I just check off each one.
Of course you picture the list in your head.
That's all I could think of.
So just before we get into the actual cranial nerve assessment too, I just put in a little nugget of remembering that cranial nerve testing is part of a full neuro exam. So, you start with perla, cranial nerves, a brief sensory motor exam of upper and lower extremities, and testing of the deep tendon reflexes, which would be a component of a full neuro exam.
Yes.
And then also this cranial nerve assessment should be done immediately after injury and then in 15 to 20 minute intervals until intracranial bleeding has been ruled out as a potential diagnosis, which honestly, that is what would cause a diminished cranial nerve.
Yeah.
98% of the time.
Yep. No, for sure.
And the other 2% of the time is all the stories we got today and the ones that I've seen. I'm pretty sure.
Yeah.
So you want to just start going in 1 to 12?
Let's do it. Here we go.
So for the first one, it's olfactory, and this one is smell, but I feel like not a lot of people test this one.
I feel like it's easy and hard at the same time because we do have stuff that smells that you could use, but then I feel like no one does it. It's just oh yeah.
Right. So this one's a sensory nerve. Oh, I didn't even talk about the sensory and mixed or both either. So I don't really pay attention to this. So I barely looked at this, but basically nerves can be sensory or motor, or they can be both sensory and motor. And so the only mnemonic, I didn't get any mnemonics for that. I mean, I didn't ask for them, but no one freely offered them up. But there was one about each one sensory motor, and the mnemonic is some say marry money, but my brother says bad business marrying money.
Oh my gosh.
So like sensory, motor, both.
Yeah.
Motor, both. Like that's like the pattern. So anyway, if you want that tidbit of knowledge, there you go.
There you go. There it is.
So anyway, back to the smelling. So I did ask people if they tested for smell.
Yeah.
And 14% of people said no.
Yeah.
Which was smaller than I thought. And then the rest were actually half and half. The 43% of yes, they do, and 43% of sometimes.
Yeah.
When I remember.
Yeah. That's pretty funny.
Which actually, I was looking into this a little bit more, and it turns out that they don't have to identify what the smell is.
Uh-huh.
It just is a distinguishment of that they can smell.
Oh, okay.
And that it's not an odd odor. So actually, sometimes people will say like, "Oh, I smell something really bad."
Yeah.
Or something like that. That's like they offer it up.
Yeah.
Which I'll go into later. One of our cranial nerves, like it was kind of like that too. So honestly, it is a hit or miss if people test this in real life.
Yeah.
But if you get a good history, you might be able to get away without.
Yeah, and also I wonder how like long COVID has affected this.
Oh, that's what I was going to say. So that, and also we know two people in our friend group who don't have a sense of smell.
Yeah, that's true.
So that is something that like
could complicate that.
You should know
ahead of time,
or at least think of. It's more common than I would have thought.
Yeah, seriously.
Do you usually test smell?
Most time, no.
Yeah, me either. I literally forget.
Yeah, I don't think about it. I don't know. I feel like it's your way. Like if they had an issue, I feel like they'd be like, I can't smell, or
right,
man, something smells really bad. Like just something that's not expected.
Or you'd like see it on their face.
Yeah. That's true. That I smell something bad on their face.
Oh yeah, that's easy. That's easy to. So Brittany B says I usually have chapstick or sunscreen or biofreeze.
It's a good idea.
Those are all things that you have in your kit.
Yeah.
Although I would be scared to put my chapstick close to someone's nose. I feel like they might put their nose on it. But I have sunscreen and biofreeze. Yeah. It's like super. Arika C said I keep ammonia towelettes in my kit. When it happens on campus and I'm in the ATR, I'll use one of my dry erase markers.
Nice.
Which we used to have ammonia towelettes, but I don't know where they are. So
I used to have a little ammonia little tablet deals that you break and it makes the smell. I want those back.
Those are intense.
Those are very intense. They'll wake you up.
Yeah, those are really intense. I wonder how different the towelettes are.
Yeah.
I think the towelettes are not as strong. But still, dry eraser markers.
Still ammonia. That's still. Whoa, hey.
Right. And if you want something not as strong, actually, I really like this one from Luke M. He said, I put coffee beans in an old Tic Tac container. I like coffee beans because it makes them think about a familiar smell that's not as strong as something like hand sanitizer.
Oh, that's a good idea. That's cool.
So whenever
plus it refreshes the palate.
Yes. And it can help you with not being nauseous sometimes.
Yeah. Yes, it can.
So also alcohol pads, that's what I'll use, either alcohol pads or hand sanitizer if I literally remember, which I probably won't. But I use alcohol pads to help with nausea. Really? So if someone's feeling nauseous, I'll give them an alcohol pad and they'll just like smell.
Interesting.
I don't know why, but it helps.
Oh.
I've used it for myself too. It helps me.
That's interesting. Okay. That's
good to know. Most of our other people wrote they use hand sanitizer. They'll use like a topical cream if it has like a stronger scent. Sharpies, dry erase markers, because those are strong. Yeah. But don't go around sniffing. Those are too long. Yeah.
If they start taking deep breaths, they might need to slow down.
You're like, you're fine. Okay, let's stop this.
We're moving on.
Yep. Okay, so next cranial nerve is optic. And this one is visual acuity, or like more specifically like what they can like see or read. So this one's like you're supposed to ask the athlete to read a scoreboard, an eye chart, like something like that. And this one's a sensory. So some of the responses that we got for people reading this one, like they'll have people read like the scoreboard or the sign to read buildings, like a sign to read or like the signs on buildings. Yeah. Some people have them read their shirt.
Okay.
Or like a paper, like stuff like that. So I used to use the scoreboard until one time I didn't pay attention to who was losing because it was per diem. And I went across to the other side and I just asked the athlete to look at the scoreboard and they were like, we're losing. And I was like, oh, maybe I shouldn't use this anymore. They were like getting killed. So now I pay attention like, okay, if you're winning, I could have you read the scoreboard because then you can get their personality a little bit more too. But
we're losing.
Now I just try to find a sign, which sometimes you can't.
No, sometimes it's hard.
Sometimes or
at least close to the field.
Right.
Sometimes that's hard.
Right.
Yeah, I use the scoreboard too.
Yeah. Sometimes I'll be like, what does it say on top of the scoreboard?
Yeah.
Like the name of the school.
Yeah.
Like, don't read me the score. You are getting killed. And then something else in this category is diplopia, which I forgot what that was, so I had to look it up, to be honest. But that's double vision. And this is something that would require immediate medical attention if it doesn't subside. But it could also be from a fracture to the orbit.
Yep. Yeah.
Which, I mean, hopefully you're ruling that out anyway, but that's good to know about double vision and the fracture.
Yeah, and we talked about it in our last education episode with VOMs. So
all coming together.
Yeah.
Okay, so this next one is ocular motor. It's the third one. It's responsible for pupillary reaction and size. It also elevates the upper eyelid and eye adduction and rolling downward. So kind of like a lot. This one, you're using the pen light for Perla, and this one's the motor.
Yep. Specifically
because the sensory is optic.
Yep.
So,
and it's in the name.
Right. So we got an anonymous story saying, I use a pen light to shine into one of my athlete's eyes, and I wait for the pupil to constrict. I repeat the same side again, but this time I look at the eye without the light to make sure that the pupil is constricting as well.
Nice.
So I've seen this where students don't do that. Like, they don't do both sides. I think that's something that's kind of missed sometimes in Perla. So you have to make sure that the eye that's like, they should be doing it together.
Yes.
So like the eye that's getting the light and the eye that's not getting the light.
Yeah.
So you have to do it twice on each side. I also asked about people who've had different sized pupils, and just under half, so 46% of ATs in our poll said that they've had an athlete with different sized pupils.
Oh, interesting.
Yeah, that was a lot higher than I expected. Have you ever had an athlete with that?
No.
Which is called anisocoria.
Yes. Yeah, no, I have not had someone who has not had a normal pupillary response.
No, not the response, just like with different sized pupils.
Oh, just like normal?
Uh-huh.
Oh, no. I was going to say, damn, 46%, that's a lot.
I know. So,
but still, that is a lot.
Right. So we had an athlete who had surgery on his eye.
Uh-huh.
And so he has different sized pupils.
Oh, okay.
So that's like good to know because he doesn't have, like, his pupillary response isn't.
Yeah, it'd be different.
Because I think one side doesn't constrict or dilate. Like it's just stable.
That's interesting. I wonder how how that affects his vision day to day.
I need to ask him.
That's good. Ooh, that's interesting.
Yeah. I don't think it does because he had it was like an old injury to his eye. Yeah.
Okay.
I think that's what happened.
Yeah.
And then he had surgery. So, I mean, he still plays. He's still an athlete. So, you want to read this one from Cassie C?
Yes. So Cassie C says, my head AT's son had different sized pupils from a migraine. Wow, that's crazy.
I know.
We sent him to the ER to be sure there was nothing else going on, and all blood work and imaging were clear. He was obviously not feeling well from the migraine, but the next day he was feeling better and everything was back to normal. Bizarre. That is crazy. That would be concerning to see that.
Right. So Apparently this is not that uncommon to get different sized pupils from a migraine.
Oh, wow. I didn't know that.
Yeah. So next time someone has migraine, maybe check them out.
Yeah. That's interesting.
Isn't that so weird?
Yeah.
I don't know what... I mean, you think migraine in the brain, like, maybe it's like...
Yeah.
Like, pressing on the
on those
nerve.
Nerves.
Yeah.
Yeah. For sure.
I don't know.
Yeah, that's crazy. That is bizarre.
Definitely not bleeding.
Yeah, it's definitely not a brain bleed.
Right. So I did have one case a couple years ago where I had this kid at football practice who was participating in just like some of their drills, and he hit the bag and then he fell and he hit his head really hard on the floor, and I didn't see it. And then he got up, he kept going, but then he comes over to me and he asked for his inhaler. So then
I remember this one.
I gave him his inhaler. This is normal. And then he goes back out. So I'm still not knowing about this head like impact, right? Goes back out. He's like doing whatever. And I think his coach started noticing that like he was kind of acting normal. And he was like, oh, he kind of put two and two together. Like, oh, he hit his head really hard on the floor. And so he comes up to me and he's like, hey, can you take a look at this kid? Because he hit his head really hard on the floor when we were doing some bag work. And I was like, okay. So then I took a look at him and he didn't have that many symptoms at the time. Like he had a decent amount of symptoms, but it wasn't like overbearing. And he was still having trouble with like his asthma. So I was kind of like working on that more. And I was like, okay, cool. Like we'll put you in concussion protocol. Like let's get you to doc, like all that stuff, right? Normal. Then we leave practice because this is almost at the end of practice. Leave practice. We're going to go like clean up, do ice, like all that stuff. Like literally maybe 30 minutes later, like maybe 45 minutes later, because we were like cleaning up, like I'm about to leave. All of a sudden, one of my other football players comes in, like rushes in, and he's like freaking out. And he is like, the kid, he's like not doing well. He is like not breathing. No, I mean, he is breathing, but like he's not breathing really well. So I was like, bring him in. So we brought him in, and he was like still having his like, he almost like had like a second, like it seemed like an asthma attack.
Yeah.
So then like we calmed down his breathing, and so then like we got him calmed down, and then I did cranial nerves again, and his pupils weren't responding, and I was like, yeah. So I was like, this is not good. So as soon as I did that I was like, okay. And that's the first thing I do. Yeah. So then I was like, shoot. And you were there too, right?
Yep.
That's what you came to pick me up that day or something? So like, I think you had just walked in and and you were like, oh, what's happening? So literally we did the pupils. His pupils didn't respond. And then I started doing like top down. So I did my facial or my trigeminal, where I like just do touch on the forehead. Yeah. And like on the face. Couldn't feel, I think it was like the left side of his face. Ooh. Couldn't feel it, which freaked me out. Yeah. And I was like, this is not good.
That's mildly concerning.
Right. So then I kept going, and I'm pretty sure those are the only two. I think he could do everything else. When he figured out that he couldn't feel half his face, he started freaking out. And his buddy was still standing there too. Who was who kept telling me, like, he was like, hey, like he's squeezing his hand, like he can't feel, like opening and closing his hand, almost like he can't feel his hand. And I was like, and it was only one side, and like I already ruled out like neck, so I was like, yeah, well, and it was the same side as his face. So I was like, yeah. So then I'm running through like everything that could like be happening, right? And I was like super nervous about second impact syndrome. Yeah. So I sent him right away to the ER because...
Well, also too, he was very emotional.
Oh yeah, he went into full...
wide spectrum of emotions.
Right. His personality was completely different. Like this kid was definitely concussed. But I was worried about second impact syndrome because of the respiratory part.
Yeah. Mm-hmm.
Because so this is I got the official definition. So this is like when you get a second blow, like even a minor blow, before like you're healed with a concussion, the brain loses ability to regulate blood flow, which leads to cerebral edema and an intracranial pressure. It can cause rapid respiratory failure, coma, permanent neurological injury, and possibly death. And the brainstem failure may occur in 2 to 5 minutes, which I didn't know.
Yeah,
that's very fast.
It's very fast.
So I sent him to the ER. I was like, we're not playing around with this. This is scary. And it ended up that I think they cleared him.
Yeah.
Because he didn't have any of this, which I was like, thank goodness. But
Yeah.
I don't know why he was having so many cranial nerve deficits.
Yeah. Yeah, seriously.
Ugh. Yeah. And I mean, he does have asthma.
Yeah.
Or he did.
Which the stress of the situation could flare up the asthma.
Right. But I don't know why he was having... I don't know what caused his face to be numb.
Yeah. That's interesting.
And I don't know what caused his pupils to not respond.
Yeah, that's interesting. I mean, remember, concussion is like a disruption of the nervous tissue. So even without the bleeding, maybe the connections from those nerves were disrupted and messed up how they function. But I mean, from a clinical standpoint, we can't that's you have to rule out a bleed.
Right.
For sure.
Well, that's the thing that was also scary was like he seemed like it was he got hit in practice, he kept going, and when he came to me, like he seemed normal enough that like with his asthma, I was mostly dealing with that, and then like when I was checking out his symptoms, like he was doing cognitively, like he was doing fine.
Yeah.
So I really think that he started to decline a lot when he started like the asthma attack came back.
Yeah.
And then he wasn't getting like oxygen.
Yeah.
And then I think that was like also really freaking him out. So that was like one very good outcome. But
Yeah.
like it just kind of checked a lot of boxes of, okay, this is not good.
Yeah. Yeah, for sure.
Okay, so next cranial nerve is cranial nerve number 4, and this is trochlear, and this is eye movements that are upward eye rolling. So this is, and it's a motor nerve, so you can use a pen light or your finger to track the medial, lateral, inferior, and superior. Mm-hmm. So this one's like a plus sign?
Yep.
I usually do like an H because it gets abducens in.
Yep. Mm-hmm.
Which actually we should just go to. Abducens is number 6. So we're going to skip number 5 for a second. Abducens, which is lateral eye movement. And this is just medial and lateral, which you can also get in your VOMs.
Yep.
So, and this is also motor. So trochlear and abducens are both motor.
And this is the one that I had a diminished cranial nerve on.
Oh, did you?
It was abducens. So I was doing per diem. And I was covering this basketball tournament, which was insane because there were like 20 courts. Because I was like the only AT there.
Sounds horrible.
Oh, it was terrible. And like, I mean, I don't know what's going on half, like literally 80% of these courts because I can't see.
Right.
They brought this.
So you really have to rely on people to bring people to you.
So I had this kid come over, someone brought over a kid who I think was like going for a layup or something and fell and hit their head on the court. So I was looking at him, and I think he just had a headache mostly. And he seemed a little off. Like you could tell he was probably a little bit slowed down. And I was going through my cranial nerves. And then when I went to do like the abducens, the lateral eye movement, he had major nystagmus. Mm. Yeah. Like his eye, like he could not control his eyes going out. Like you would see the shake and like, dude. Yeah, this is a problem.
On only one side, or was it both?
It was
directions?
both sides. It was both sides. It was going both ways. Yeah.
Was it only one eye or both eyes?
Both eyes.
Wow.
Yeah.
So I was just talking to students about this because nystagmus is, so okay, that's just also what I'm confused about because for cranial nerves, technically you're looking for nystagmus, right? Mm-hmm. But also nystagmus doesn't necessarily mean that the cranial nerves diminished. Because you could have nystagmus, so I showed my students, I was like, watch, I'm going to find, like, I just turned around, found a football player, and I was like, look, we did diagonal movement, and he had nystagmus.
Yeah. Some people, it is normal for them.
But you don't have a baseline on everyone.
Yeah,
you don't know what they're.
And then also too, like, there's also a difference between like I think them kind of like resetting their eyes. Like when you're coming back to baseline, like there will be a shake because the person like almost like recalibrates their eyes. Like that's not like abnormal. It's a lot of times it's during the movement that you're supposed to be watching to see how their eye reacts. So just because like, oh, their eye kind of shook when you're coming back to the middle, that doesn't necessarily mean like, oh, that's pathological.
I've seen one, and I wish I remembered more of this story, but I did see one that was literally like as they were tracking, like it jumped and they couldn't follow the track, which I guess that would be a positive.
Yeah. No, for sure. That would be a positive.
So for these, this is also where this is accommodation is that's VOMs, right? That is
a part of VOMs.
That's not cranial nerve. So this is where I actually add in accommodation.
See, you're throwing in the VOMs.
It's valuable.
It's voluble.
Yeah. So if you do trochlear and abducens together and accommodation, then you just have a bunch of all in one.
Yep, all
three
in
in one. So then in between 4 and 6, we have trigeminal, which is a fifth one. This is facial sensation. This on the face is like the big, like 5 makes up the face of the picture.
Yep.
So this is, you're supposed to ask the athlete if like light facial touch is perceived normally. You also ask the athlete to bite down because it's a mixed nerve. So we have the sensory, which is like the nose, forehead, temple, scalp, lips, tongue, and lower jaw, like the sensory of those. And then motor, which is muscles of mastication. So the bite down.
Yeah.
So usually how I test this is I have them close their eyes and I'll touch the side of their forehead and I'll like with the back of my fingers and I'll be like, what did I just do? They'll like touch my head. I'll be like, which side?
Nice.
Right. Because then it's no, yes, no, because they will say yes.
Yep. Yeah.
This is how I figured out the kid couldn't feel half his forehead.
Yeah. And that's kind of what I do. I just ask, where am I? And then like, oh, my cheek, my left cheek.
Oh, you know what? I just realized the kid also, as soon as he realized he couldn't feel, he kept touching his forehead. Like he
to see if he'll come back.
And he wouldn't stop touching his forehead.
I remember
I was
that.
like, oh, that's not good. That probably feels so weird.
Yeah, I bet.
Okay, so we did number 6, which is abducens. Then we're on 7, which is facial. This one is not. I always mix this one up with trigeminal because trigeminal is the one where you're feeling their face. You know what? Actually, I think the 5 is 5 is like the big face, but 7's like the outlines of the head for the picture. So 7 facial is facial expression. So this is smile, wrinkle forehead.
No, big smile.
Big smile.
Big smile, big frown.
Big frown.
And no one can frown.
No. But you know what? I like asking about the frown because you're like big smile and they smile and then big frown. And then most people are like, I don't know how to frown. And then they like try to frown and it's funny. And then you can see their personality.
Yep, exactly. I know. It's always funny to watch people's interpretation of what a frown is.
Right.
It's like, hey, so you can see the facial nerve working.
Right. So that's the motor side is the muscle of expression, but facial is also the sensory taste.
Yeah, I feel like that's never tested.
No. So technically, like you're supposed to hit both sensory and motor because if you just do motor, technically you're not getting all of that nerve. But, and I didn't ask about how many people did taste, but I'm pretty sure it's less than smell.
I'm sure. Here's some Gatorade. What flavor is that one?
Oh, that's a good one.
Yeah.
But there are some people who said about taste, they'll ask like while they're smelling, like ask what it would taste like or like what they're tasting currently.
Yeah.
Or because this is another one like very similar to the smell that's like, they'll be like, oh, like I like this doesn't taste like there's a taste in my mouth that doesn't taste
Not
good. Right. So if you just ask about those, ideally you should be getting an actual like something for them to taste like gum or like Even if they just like lick the gum, they don't have to like chew the gum. Although that would show you trigeminal muscles of mastication.
Yeah, yeah, it would.
But we haven't gotten down to the inability to swallow yet, which could be a problem if you give them something to eat. So just keep in mind.
Yeah.
So you want to read this story?
Yeah, this one's by Mary H. One of my boys' lacrosse players years ago got Bell's palsy temporarily from a hit/check to the head. His one side of his mouth couldn't smile/go up, and he had trouble opening his eyes all the way on the same side. There wasn't a set order of cranial nerve tests that I did, but I went through what I remember in whatever order they came to mind. But it was pretty obvious something was wrong. Oh, yeah, for sure.
Isn't that crazy?
Yeah. To see them not be able to, like, fully smile and see, like, half the face not responding, that'd be interesting.
And that's probably scary for them,
sure.
too.
Especially for the athlete.
Right.
You know, they're like, oh, this is weird.
Right.
And then, I mean, when everyone thinks of the most, like, some of, like, signs of a stroke, right? Face paralysis is one of them. So I could imagine like being in that position and you're like, am I having a stroke? So
I did ask Mary about like, wow, that like, how long did that last? And she was like, well, it was like 15 years ago. So it was scary for all of us, the kid, the mom, me. I was shocked. He probably had it for a few weeks from what I remember. And we referred to his primary because I wasn't sure who else to refer him to. Which, I mean, that I feel like you're hearing more about Bell's palsy, which the good thing is it is temporary.
Yeah.
But it's like, that's so scary.
Yeah.
Right.
Especially when it comes from like a contact blow to the head, because then you got to think, okay, is it just that or is it more?
Is there like some stroke going on or like some other
brain bleed?
Yeah. Seriously. Hope there's not picture day. If you can't get half your face to smile.
That'd be so messed up. Poor kid.
Especially in high school. Is this high school? Boys lacrosse?
Yeah, I'd say so. It'd be either high school or middle school.
Right.
Which both times are terrible for everybody.
Right.
Kids are mean.
Kids are mean. Okay, so the next one is, what number is this? 8?
Yep.
Vestibular cochlear. That's hard to say. Which is also acoustic. Why is that also hard to say?
That's what I remembered it as. Just instead of that whole thing, just acoustic.
Yeah, I mean number 8.
Yep.
It's the ears. It's the little 8 number ears on the face. This is hearing, balance, equilibrium. This is a sensory nerve, so you have them close their eyes and snap next to each ear to check the hearing. And then conduct balance tests such as like a tandem stance or a best test.
Yep.
I do the same thing with like the face where I like have them. Actually, you know what? I already said this, I think. I start with the forehead and then I move to the ears because I keep their eyes closed. So I do like eyes closed face, like forehead, and then I'll do eyes closed snap. And I'll say how many times do I snap because I'll do like 1 or 2 or 3 on each side. How many times? What side? And then the next side. How many times? What side? Is that how you do it too?
Yep, pretty much.
Yeah. I don't. And then best, like you do that in your concussion testing.
Yes.
So I don't really like do a specific, like I just kind of wait till we get to that. And
plus you get a good idea of that when
they're sitting too.
When they're sitting, when they're
walking over.
Yeah.
Okay, almost done. Number 9, glossopharyngeal. This is swallowing and voice. I didn't know that voice is part of it, actually.
That's true. I didn't think of that either. I mean, it makes sense, but...
So this is asking athlete to swallow and speak. This is both a motor and sensory. The motor is going to be the pharyngeal muscles for swallowing. And then sensory is going to be taste.
Oh, interesting.
So I actually did have someone, and actually I'm going to go to the next one too, because this vagus, number 10, vagus nerve, swallowing and gag reflex, which this is also, you're supposed to ask your athlete to swallow. And I've never done this, but according to the book, like textbook, using a tongue depressor, you're supposed to check the gag reflex.
Interesting. That's messed up.
I know. I think that you would not get any credibility.
How I've seen it was you have them go, ah, and then you see the uvula.
Right.
And if it deviates, that's a problem.
Right. That's what I learned too. So anyway, motor and sensory, it's both. So motor is going to be muscles of pharynx and larynx, and then sensory is going to be gag reflex. So for both these, 9 and 10 are both have to do with swallowing, which when I had a performing artist in a big costume whose head got stuck, it got hit, so she went into full flexion and extension of her neck, which was like kind of like a whiplash injury.
Yeah.
She had diminished swallowing. She was having trouble swallowing. She was still able to do it, but it took her a few tries to actually swallow.
Yeah.
Which I looked it up later because I never saw her again, so I don't actually know I don't have like the full details of like what happened, because we were worried about C-spine and we were worried about cranial nerves because of that. I can't remember if she was also having trouble speaking. I feel like she was speaking really slow.
Okay.
She was also older. So, it was definitely not her normal.
Yeah.
But she was like, we were trying to talk to her and she was trying to answer, but I wasn't sure if the speaking slow was because she was having trouble swallowing.
Yeah.
Or if it was swallowing and voice, because I didn't know that voice was part of it.
Yeah. Yeah. That's true.
So she, I looked up why her cranial nerve would be diminished, and it turns out that like in a whiplash case, especially these lower cranial nerves, they can be affected. So like
that's interesting.
9, 10, 11, 12, I think, the lower ones, because of where they are, they're more likely to be like, because nerves don't like stretch or compression. So because of that whiplash, it could be that it was diminished because of that.
Interesting.
Right, so it doesn't necessarily have to be a brain bleed.
Yeah, for sure.
Which is probably why I saw it in her, because I don't know. Yeah. We weren't with her for long enough to determine if she had a brain bleed, and she was referred. I don't think that she had a brain bleed. It was more like neck than like head. I mean, obviously you don't know what's going on, but I'm pretty sure it was from the whiplash.
Yeah, for sure.
And then finally, moving on to our final two, we have accessory, which is spinal.
It's always the fun one. Shrug.
I didn't know it was called spinal. I've never heard it called spinal.
Nah, I've always just known it as accessory.
So accessory, which is neck strength, trap, and SCM.
Yep.
And then this one's a motor, and you check isometric strength of the neck muscles with a shoulder shrug. And then lastly, hypoglossal, which is our 12th nerve, tongue movement and strength. You ask athletes to stick out their tongue, move medial and lateral. And this one's also motor.
Yep. Move it side to side.
Move it side to side. So, you want to read the story from Joe?
Yes, this one's by Joe S. Taekwondo athlete lost the ability to control movement of her tongue. She was unable to push against the side of her cheek where my finger was pushing against it. Although I don't remember the mechanism of injury, Taekwondo is basically a kicking martial art, so the fighter probably sustained a kick to the head and suffered a concussion. The fighter was removed from any further competition that day, and per US TKD, was placed on a 30-day hold from return to play and needed an MD clearance. 30-day hold? That's interesting.
Mm-hmm.
I do not know any follow-up info, as this happened quite a number of years ago, and the athlete was not local to the event. That's interesting to see them not be able to have like tongue function or like having that strength in the tongue. That's interesting.
Also, this is really fascinating because like when I do my cranial nerves, I just have them stick out their tongue and move it side to side.
Yeah.
I've never thought about having them like, because you're technically also, it's not only just tongue movement, but also tongue strength.
Yes. Yeah, that's true.
So having them put their tongue against the side of their mouth or cheek and then pressing on that.
Yeah.
Because then you can test their strength. That is a really interesting way to do that.
Yeah, for sure.
Yeah, I really like that. So, can you just run through real quick, like, your cranial nerves? Like, start to finish.
Like how I do it?
Uh-huh.
Okay, so I'll probably go shrug, boom, and then I'll have them close their eyes. I'll test, like, trigeminal, so, like, the actual facial sensations. Mm-hmm. And then while their eyes are closed, I do their ears. And then eyes are open. I have them give them a big smile, big frown, stick out your tongue, move it side to side, and then I'll check the eyes. And then if I remember the swallowing, I'm like, okay, go and swallow.
I do it all in one. Maybe we should do a bonus content on this, like a video of us doing cranial nerves.
Yeah.
Let's do that. Okay, we're gonna do that. Maybe, hopefully.
Well, we got to now.
Okay, so check our YouTube / show notes for that. So just scroll down. We'll put a little link in the show notes. So the way I do it is I'll do a or top down. So I start with eyes because I'll forget. So pupillary response, I'll do the perla, both sides, 1, 2. And then I'll do the eye movements, so the H, and then I'll do the accommodation, and then real quick I'll do the eyes closed, get the face, and then eyes closed, do the snapping on both sides, and then smell if I remember, which I probably usually don't. Smile, big frown, stick out your tongue, move it side to side, big swallow, bite down, and then shrug. Mm-hmm. And then I move into balance and the rest of testing. Okay, so that kind of makes it, that's it for cranial nerves, all we have.
Yeah, no, that was perfect.
So if you guys have any other stories that you want to share, we have story episodes coming up. Every other episode is a story episode. Every other episode is an education episode. So we'll check out our Instagram and our Facebook group, facebook.com/group/AT Corner for that. And I think that's it.
Thank you for helping us showcase athletic training behind the tape. Bye.